Yeah, it's been absolutely remarkable. I mean, I have friends who are in radiology, anesthesiology, dermatology there,
Right.
and so many of them have been pulled for months to go help
Hmm.
out on the wards. And it's one of those things that's scary, but at the same time, it's like awesome to see,
Yeah,
like physicians
absolutely.
coming together
Absolutely.
and that I don't know what's your opinion of that. I want to pick your brain on this, but the concept of having a intern year prior to ophthalmology, whether it's a preliminary year, a transitional year, a lot of ophthalmologists I've spoken to regarding the value of that, a full year potentially of medicine, are kind of split 50-50. Some say, you know what, like I don't remember anything from that year. None of that's really carried over into ophthalmology besides the basics of being efficient or
Hmm.
doing patient care. And then there's some people here, some really high volume surgeons who have said, learning how to manage diabetes or kidney failure was like a really essential experience. Like, absolutely, that should be a part of training.
Yeah.
And now we're in the situation where so many of our friends are being pulled who are not in primary care
Right.
to do that. And it's like, there's clearly value to doing that intern year.
Absolutely.
As someone now who's just finishing retina fellowship, let's put COVID out of the picture and
Hmm.
pretend that didn't happen. Do you feel like 12 months of medicine is necessary, or do you think some of these transitional years or integrated intern years where you're getting to do more ophthalmology early on is the way to go?
I 100% think that 12 years of medicine is not a waste. I think it was really helpful in my formation as a physician. We did a lot of ICU, and in retina we deal with a lot of patients that are very, very sick. I've had 4 patients either code or about to code in the clinic, and sometimes during the weekend when there's no one else around. So if you don't know how to handle that, patients can die in your chair. So I'm extremely grateful that I did intern year, and that we had 2 medical codes a week in the hospital, and we were running not running, but participating in some of those codes. And then sometimes until a more senior person got there, you were essentially running the code until the code team got there. So I think it's very valuable. I think there's a reason why we all take ACLS and BLS, and it's not a waste. I mean, we're physicians first, we're ophthalmologists second, and then subspecialists third. So I agree. I did not do a transitional year for that same reason.
Really?
I wanted to do full on medicine for a year, and I thought it was going to be helpful for me. And I think I made the right choice. I don't regret it by any means.
That's really interesting to hear. I don't know too many people who purposely chose a preliminary year just for that reason. Uh, I think a lot of people just wanted as much ophthalmology time during intern year as possible, or not, a really strenuous intern
Right.
year where you're just doing tons of ICU, tons of night shifts, tons of medicine. I've heard of some people, you're probably the first actually to ever say that to me. I know I've heard of some people really wanting to do like a surgical preliminary year,
Hmm.
but that's awesome to hear.
Yeah.
Did you, when you were there in New York, did you have any time to work with ophthalmologists at all?
So
Or
not at all. I actually did zero ophthalmology other than read on my own. Probably the last month or so of intern year. So no, it's just purely medicine. I didn't choose a surgical transitional year or preliminary year because I felt like the surgical skills and in general surgery wouldn't really help me a ton in terms of ophthalmic surgery. Now that may or may not be correct, but I felt like the intensive care unit and the medical part of managing complex medical conditions was more essential to my formation as a physician, and that I would get my surgical training from my surgical residency.
right?
So
Yeah, and I'm not sure even how much in those surgical prelim years where you actually get to be in the OR as opposed to just managing floor patients.
correct.
Yeah, although I've heard, I think there was,
It varies. I'm sure there are surgical preliminary years where you're in the OR more than others, and probably some to a good degree.
yeah,
I mean, um, it's not a waste of time either. It's just, in my mind, I thought it made more sense to do a medicine year.
right. I think there's one or two programs I remember when I was applying to residency where they mandated it. They mandated that you had to do a surgical prelim year at their institution,
Interesting.
but they had it as sort of a good gig where they said you wouldn't be, I think, covering surgical call. You would be in the OR. You were going to get to work on some of the more fine motor microsurgical type skills. So
Hmm.
you're right. It's just intern year is so different regardless of where you
Right.
go. And now we're seeing this push probably in the next 2-3 years for all intern years to become integrated.
Right.
Ours here is kind of unique in that we have 5 or 6 months of ophthalmology, and then the rest is pretty intensive, pure medicine. But I think they're going to make it so that in the future you can't have more than 3 months, which I think is a nice balance
Cannot have more than 3 months of
of
ophthalmology.
ophthalmology, right?
Okay.
I think the issue, and this is me just, I'm not a ophthalmic medical educator or
Right.
plugged into the circle or anything, but I think the issue is that there are some institutions that don't have the resources to do more than 3 months or who don't have affiliations with local hospitals. And I think some of those circumstances are for some of the bigger programs,
Yeah.
which
Right.
is kind of interesting. But I think going forward, almost all incoming ophthalmology residents will have at least 3 months of ophthalmology. And I totally agree with you. I think, we are physicians first. There is definite benefit. It's not wasted time during an intern year. I did a TY year, but a lot of that was medicine.
Hmm.
I spent, I think, 2 months in the ICU, 2 to 4 weeks of nights in the ICU. But I think ophthalmology today is so different and has become so much more advanced than it was 20, 30, 40 years ago.
Absolutely.
Like you look at the stack of BCSE books from the 70s or 80s and they're quite thin, and now the stack is just getting bigger and bigger as we're
Yeah.
learning more about the eye. There's more and more to learn. I almost feel like 3 years is not enough. Now obviously we're lifelong learners, we're going to continue to grow
Yeah.
and learn as we get into practice, but I almost feel like that exposure is worthwhile. um, but I would never say it's at the expense of an entire year
Right.
of medical
I
training.
think a 9 to 12, 9 out of 12 month balance seems reasonable. I wouldn't argue that 3 more months in a 36-month training span would make a huge difference, particularly when it's at a time where you don't know anything about ophthalmology.
Yeah.
But different people can have different opinions about that. And